Well, Fred, you know, February is American Heart Month, and we are on your side to keep you healthy and aware. And today we're going to be joining virtually when we talk with nurse practitioner Kirsten Larsen-Vansant. She joins us virtually. How you doing, Kirsten?
I'm doing really well, Sheldon. Thank you so much for having me today.
Yeah, you bet. So why is heart health so important to you? This is a personal note, isn't it?
It definitely is. You know, when my mom was 47, she was having episodes of chest pain and passing out, and she ended up at the heart doctor, at the cardiologist. They did routine tests, an echo and a stress test. Her stress test was really abnormal, and so she ended up having the heart cath the same day to look at the heart arteries, and then the next day ended up having bypass. She had serious disease that needed to be intervened on really quickly. So now that I'm getting closer to that age, I focus my personal and professional life on proactive and preventive health. You know, a lot of times people come to my office for chest pain, for pressure with activity, left arm or left jaw pain, pain between the shoulder blades, especially women, and even palpitations, dizziness, headaches. Each person's heart speaks to them in different ways. And just like my mom, I don't want to take any of that lightly.
Well, with that in mind, when should we start? When should each one of us start thinking about keeping our heart healthy?
Well, honestly, you know, as a parent, you could start from birth, and as a person at any age, it's right now is what matters. Today is the best day to start fresh. You know, as I try to teach my kids healthy eating habits and great activity, we try to limit sugar and stay hydrated, all the things that we hear about all the time. And, you know, the big thing for us is activity, trying to get 30 minutes of activity every day. And it's not, you know, let's walk to the kitchen or make a little lap around the house. It's get your heart rate up for a good 30 minutes. You can break it up. 15 minutes twice a day works just as well. But that activity with the heart rate up is super important.
Okay, we got about 30 seconds left. So when a nurse practitioner, such as yourself, how do you help in the care for the heart?
I appreciate you asking that. You know, we like to focus on preventive care. And so we are medical providers. We can order screening, diagnostic testing. We can help interpret those and speak really closely with the patients to help develop short and long-term care goals to help prevent any kind of cardiac issues.
Nurse practitioner Kirsten Larsen-Vansant, thank you so much, especially when you were joining and sharing about your personal story and testimony. Certainly do appreciate that. That means a lot, okay?
Thanks so much, Sheldon. I appreciate it.
All right, we've got